Thanks for joining us today. We're discussing end-of-life issues, and the topics of the discussion have gone from living wills to medical surrogacy. Now they're to DNRs, and these come up in my practice in dealing with seriously injured folks and their families. Once you get to the hospital and meet with the family, and these issues come up, and as a lawyer that specializes in wrongful death and serious personal injury, these families ask me questions about these kind of things, and Dr. Malone is here to talk about what's called a DNR and the various different types of DNR type orders. Dr. Malone, tell us what a DNR is and the types of DNRs that are out there.
Joe, a DNR is actually do not resuscitate, is what it stands for, and it's a medical order as ordered by a physician of any sort. Many times these come up most notably in an acute care setting. There are a handful of patients who will carry their DNR order around with them, either in some sort of a binder, in their wallet, in their purse. And these are patients who are usually spending a lot of time in the hospital for any number of reasons. Maybe they have a terminal diagnosis. In an acute care setting, whenever someone is elected to have a DNR order placed, it's usually after discussion with the medical care team as well as with the patient and or family members, stating, in the event that my heart and or my lungs stop doing their jobs, meaning I have a malignant arrhythmia, I have no heartbeat at all, or a complete respiratory collapse, do not do anything in order to revive me, meaning CPR, endotracheal intubation, emergency medications to get the heart restarted. So that's the most extreme end of it as far as saying, I don't want that. That doesn't mean do not treat. You still treat with IV medications appropriate for whatever diagnosis you have at the time, be it dehydration, you're getting IV fluids, an infection, you're getting IV antibiotics. Even if you have an acute need for surgery, you're still having that procedure done. So do not resuscitate does not mean do not treat. Now, there are other levels of do not resuscitate that some patients feel most comfortable and that apply to them. There is do not intubate, meaning I don't ever want to be on a mechanical ventilator. There's no chest compressions, meaning you can get all the other IV medications needed to restart the heart. You can even be on a ventilator, but whatever you do, don't resuscitate me by doing chest compressions. And again, this is getting into a whole lot of a gray area. Some hospitals have different protocols, but the most basic is the do not resuscitate order.
And do not resuscitate orders are things that patients will be confronted with while they're in the hospital, is that right?
Many times upon hospitalization, some member of the care team will ask a patient and or their family members if a DNR order has ever been discussed. It doesn't mean that the medical care team is pushing for that. They just want to make sure that everybody's on the same page, make sure everybody's fully informed in the event that this does happen. You can be hospitalized for something relatively simple, and I would not be surprised nowadays if someone comes up to you on the level of like a nurse manager or something to ask you if you want to be DNR. And again, with the prevalence of these DNR orders nowadays, it's something to consider.
All right. Thanks very much. I hope this has been informative on DNRs.